Start. Hi, everybody. Welcome to the first session on the very first day of HDC's Affordable Housing Week. We just had a kickoff this morning, and it's exciting to have this session be the first official session of Affordable Housing Week. My name is Danny Turk. I use she, her pronouns, and I'm the Membership Programs and Equity Manager for the Housing Development Consortium. Welcome. So we are connecting today from 1 to 2:30, focused on creating safe and inclusive services for LGBTQ plus older adults living in subsidized and affordable housing communities. So I will shortly be putting the link in the chat for other Affordable Housing Week sessions. It's going to be a packed week, and we're super stoked to have you all here in support. And I would be remiss if I didn't give a shout out and big thanks to our sponsors. We're really grateful for your generosity and your support. So I'm really pleased to welcome Ruben Rivera-Jackman, who's a social service coordinator working at the Filipino Community Village through Human Good. And this session is intended to address LGBTQ older adults relying on affordable housing and subsidized housing, and the providers who provide the safe and discriminatory-free housing environments. And so we recognize it's crucial that affordable housing providers become knowledgeable about the aging needs of the LGBTQ plus community, the residents, and work to create inclusive and welcoming environments that are supportive and free from discrimination and bullying. So with that said, Ruben, I'm excited to welcome you here. I'm going to read Ruben's bio. So Ruben and I have been working together for years through the Resident Service Affinity Group, and Ruben has been very generously offering trainings to the community. And I just feel so grateful and humbled to have Ruben, to have you here to be offering this session. Thank you.
Thank you. So
Ruben Rivera-Jackman is a speaker, trainer, and nonprofit leadership consultant with a 35 plus years career in as a nonprofit leader with practical experience in and solid understanding of a diverse range of management, program development, and service delivery applications. Ruben has a passion for working with and advocating on behalf of older adults, and has a natural ability of providing instruction and training for adult learners. Ruben is a certified trainer with National Resource Center on LGBT Aging and serves as an adjunct professor at Seattle College, where he teaches classes, a variety of courses for social service and behavioral health department. Ruben has lived in the state of Washington for the past 27 years with Nick, his husband of 29 years, and a 7-year-old American Staffordshire Terrier named Olivia and 5-month-old Bulldog Oliver. He's the proud parent of a 37-year-old son, Alex. Welcome, Ruben.
Thank you for that introduction, Danny. And I want to thank you and HDC for making this session available for our attendees today. So good afternoon, everyone, and welcome to this presentation, Creating Safe and Welcoming Environment for LGBTQ Residents. As Danny mentioned, my name is Ruben Rivera-Jackman, and I use he, him pronouns. And this is my contact information. So after this session, if you need to reach out or want additional support or any supplemental information that I share with you today, I'll be happy to email those to you. And you also have my phone number, which is actually, I just realized it's my direct phone number. So there you go. This is my actual cell phone number. Feel free to reach out if you need additional support or resources. I'm happy to help in any way that I can. So I want to go ahead again and thank you and welcome you to today's session. And we're going to get right into it since we have some information, lots of information I want to share with you today.
Ruben,
yes.
Ruben, before you get going, one of the pieces I just want to share with folks, as you have questions, please feel free to add those into the chat. I'll be monitoring the chat. Ruben has graciously offered to answer questions as he's going along. So please feel free. And again, I'm dropping in the chat our Affordable Housing Week link for other sessions you may be interested in. Thank you, Ruben, and to you.
As Danny mentioned, I am one of the certified trainers with the National Resource Center on LGBTQ aging, and some of the information and materials that I'm going to share with you was developed by the National Resource Center. So I just want to give them credit for information that I will be sharing with you today. They are a wonderful website, and I will give you that link at the end of the presentation, and it is also provided for you in the handout. So great resource, wealth of information on the LGBTQagingcenter.org website. And this is if you go to the website, this is their website. They are now under the auspices of SAGE, which is Advocacy and Services for LGBTQ Elders. And there's affiliates all over the country, SAGE affiliates. We have one, I believe, here in Olympia, Washington. I believe that one is still in existence. But there are SAGE affiliates all over the country. And again, their website, they have a resource education here. They have a library of a lot of wonderful resources that are free. So feel free to reach out to them. Or again, you can always reach out to me and I'll be happy to look for any resource that you're looking for. So today's presentation goal or takeaways are to enhance awareness amongst affordable senior housing providers about the importance of creating safe and inclusive services for LGBTQ older adults. This workshop presentation is designed to help you to continue to do the things you do well already while enhancing your ability to extend this great care and service to LGBTQ older adults. So just to get an idea, if you don't mind putting in the chat room, what is your current role in your position? Are you a housing provider, property manager, case manager, social worker? If any of the roles are not listed here, can you just go ahead and put it in the web, in the chat room? I just want to have an idea of who we have with us here today. And I want to make it as interactive as possible. So. Architect,
Wow,
great.
this is amazing. What a nice array of roles that folks are coming in with. I really appreciate the interest. It's amazing.
Yes, welcome. Thank you for sharing that. That's really amazing. So, and again, feel free to put any questions in the chat box as we move forward. So let's go ahead and start. So I just wanted to share and start by saying that promoting diversity and inclusion is important, and language and communication shapes the culture and atmosphere within our housing communities. Language and communication also play a pivotal role in creating a welcoming environment, particularly in housing contexts where individuals from diverse backgrounds come together. As Danny mentioned, I've been in the housing field for over 30 years. I decided to go back into service coordination, but I've been a director and manager of housing programs. I worked for the King County Housing Authority for over 12 years. I was with SHAG for a couple years. And I also worked at Imagine Housing in Bellevue for a year. So I've been in the housing, affordable housing, public housing, HUD subsidized housing, and tax credit housing arena for a while. So I'll be happy to share. And as we go along, I will probably be sharing some of the some experiences that I've had in my career around working with LGBTQ older adults in housing. So it's important for housing providers to use language to actively promote diversity, equity, and inclusion by celebrating cultural differences, affirming identities, and challenging stereotypes or biases. And again, clear communication about anti-discrimination policies and resources for support sends a message that discrimination and harassment will not be tolerated. I'll give you a little bit of information at the toward the end. We're going to talk a little bit about fair housing, and we're going to talk about fair housing laws specifically that apply here in Washington State, so that you have that information. So the reason I want to spend more time on this is because we believe that in order to begin this presentation, we need to be clear about the terms that we're using. And the terms evolve and they change constantly. So trying to stay on top of the most common, most used and common terminology can change. But I'm going to give you the most common ones today because terms are crucial, because finding out how the person describes him or herself and then using that language are primary ways of conveying respect and openness. So that's how important terminology is. Language and communication are foundational elements in creating a welcoming environment in a housing context. By using inclusive language, fostering trust, ensuring accessibility, solving conflicts effectively, promoting diversity and inclusion, and empowering individuals, housing providers can cultivate environments where everyone feels valued, respected, and supported. It is important to know which words carry positive or negative undertones. For example, the term homosexual should be avoided because it has taken on a negative connotation because of its previous use to denote mental illness. In case you didn't know, the American Psychiatric Association actually removed homosexual from clinical diagnosis from being a mental health diagnosis back in 1973. And it was officially removed from the Diagnostic Statistical Manual back then, which was 2, we're up to 5 now, in 1987. So as you can imagine, all the way up to 1987, homosexuality was considered a mental illness, and it was actually in that DSM-2 as a diagnosis. So that's why we prefer to use the word gay, lesbian, bisexual, transgender, or queer, as opposed to using the term homosexual itself. So I'm going to go over, again, provide an overview of some of the common LGBTQ terminology, but I'm going to focusing mostly on lesbian, gay, bisexual, transgender, and queer. So when we look at the term lesbian, it refers to a woman who's emotionally, romantically, or sexually attracted to other women. When we look at the term gay, although it was originally used to refer to men who are attracted to other men, but now commonly used as an umbrella term for anyone who's attracted to people of the same gender. Bisexual is someone who's attracted to people of both their own gender and other genders. Transgender individuals, again, transgender, the term is also an umbrella term for people whose gender identity differs from the sex they were assigned at birth. Transgender people may transition socially, medically, or legally to live as the gender with which they identify. When we look at the word queer, historically used as a derogatory term, it has been reclaimed by some members of the LGBT community. And that's important for you to understand that not the whole community has reclaimed the term, but some members, including millennials and younger members. For many older adults, the term queer can still have negative connotation and have some trauma associated with the term queer because it was the term that was used against them when they were younger. So you just want to be careful with the word queer. Of course, you want to use the word if someone says that they want you to use the word queer and they give you permission to use that word, it will be fine to do that. As an inclusive term for anyone who does not conform to heterosexual or cisgender norms, it can also encompass a wide range of identities and expression. So you'll see that I won't focus a lot on the word queer just because, as I mentioned, for many older adults, the word queer is not a word that they refer or want to be referred to. Questioning, which is the other Q, refers to individuals who are exploring their own sexual orientation or gender identity. Intersex. Intersex is a person born with reproductive or sexual anatomy that doesn't fit typically definitions of male or female. And the term asexual is for someone who experiences little or no sexual attraction to others. Pansexual are folks that are attracted to people regardless of their gender identity or biological sex. And when we look at the term non-binary, it is a gender identity that's not exclusively aligned with being male or female. Non-binary people may identify as both, neither, a combination of both, or as a different gender altogether. And these are the folks that you'll see that'll use the pronouns they, them, and theirs. Gender queer, similar to non-binary, gender queer describes a gender identity that rejects traditional binary classifications of gender. And then cisgender, which is a term for people whose gender identity matches the sex they were assigned at birth, at the time of birth. When we look at the term sexual orientation, the community includes individuals who identify as lesbian, gay, bisexual, pansexual, asexual, and more. Each of these orientations represent different ways of experiencing and expressing attraction. When we look at the term gender identity, it is a spectrum, and the LGBTQ community includes people who identify as transgender, non-binary, genderqueer, gender fluid, agender, and more. Each person's experience of gender is unique and valid. So those were the common terms I wanted to share with you. For some of you, some of these terms you may have heard them for the first time and may be new to you. So if you have any questions or need further clarification, please feel free. This is a safe place for you to ask any question that you want. There's no such thing as a dumb question, and my life is an open book. I'm also, you'll see later, I identify as a New Yorican gay cisgender man of color. And I just celebrated my 29th anniversary with my husband on Friday. We've been together since 1995. And so, yeah, I'm happy to share some of my own personal experiences. So again, as terminology continues to evolve and the way it is used to describe LGBTQ people and aging adults, it's important to be aware that terms may have different meanings based on the person's age, life experience, and cultural heritage. As I mentioned earlier with the word queer, we just want to be careful not to offend anyone. So we want to ask their permission and only use that word when that permission is granted. Here I put a screenshot and I just described all of these, right? LGBT2SQQIA plus. So our acronym keeps growing and getting bigger. So I just wanted here to address the QIP2SAA. So the two Qs cover both bases, queer and questioning. I is for intersex, again, people with two sets of genitalia or various chromosomal differences. P is for pansexual, which I also gave you the definition, but it's people who refuse to be pinned down on the Kinsey scale. When we look at the 2S, the first 1S is for two-spirited, which is a tradition in many First Nations that consider sexual minorities to have both male and female spirits. A is for asexual, people who do not identify with any orientation. And the other A is for allies, recognizing that community thrives best with loving supporters, although they're not really part of the community itself. So any of you who are joining us today who are an ally, I want to thank you on behalf of all LGBTQ older adults and all members of the community for being an ally and supporting us. So appreciate that. So the reason for sharing this information around terminology and getting into details about it is because knowledge is the highest form of respect, right? So thank you again for attending today's session. Kudos to you for being here and enhancing your awareness and knowledge around LGBTQ older adults who live in affordable public housing. Respect is important, right? It's important to know that language and terminology evolve over time, and different individuals and communities may use terms in varying ways. So respect for individuals' self-identified terms and identities is crucial when working with this population. So here's some practical tips for respectful communication. You always want to use gender-neutral language whenever possible. You want to avoid making assumptions about the individual's identities, backgrounds, or preferences. And you can ask for and respect the individual's preferred names and pronouns. You want to use inclusive terminology that recognizes and respects diversity by, at the same time, being mindful of cultural differences and adapt communication styles accordingly. You want to listen actively and empathetically to others' perspectives and experiences and avoid offensive or derogatory language and address inappropriate behavior promptly and professionally. So as a service coordinator, my office is located in the lobby. I have two communities, Filipino Community Village, which is located in Columbia City. And then I have another property, which is the property I'm in today, which is at Northgate, which is called North Haven West. And these are two senior properties. They're two tax credit properties that are owned and operated by Human Good, which is based out of California. And my office is located near the mailbox and in the lobby. And I can't tell you how often I have to often leave my office and go out to the lobby to address residents' comments that are being made publicly and openly in common areas that can be offensive to others. So I'm constantly reminding residents to be mindful of the language that they're using and how that language can be construed to be offensive to other individuals. So I'm constantly setting boundaries and correcting individuals to make sure that everyone who lives in our communities feels safe. Not just LGBTQ older adults, but even older adults that come from different cultures, who may be here, who came in as immigrants, who may not speak English. There's a lot of biases that happens, unfortunately, in a lot of our communities. So I'm often constantly addressing those violations that I hear. So I often say, if you see or hear something, you must say or do something. We cannot be complicit, and we cannot ignore or avoid addressing issues when they come up, because then we become complicit. And if other residents see that staff are not coming to their rescue or not coming to correct the behavior, then they think that we also feel the same way. And it'll be harder for us to build trust and rapport with our residents, who won't feel comfortable coming to us because they think that we're part of the problem instead of part of the solution, which is why it's important that we address these violations when they happen, regardless of the person's sexual orientation or gender identity. So I just wanted to give you a little information on some of the demographics here. So estimating the exact number of LGBTQ adults living in the US is challenging due to several factors, including variations in self-identification, evolving societal attitudes, and the methodology of surveys and studies. Several recent studies suggest that around 5 to 10% of adults identify as LGBTQ. I want to say that back in 2010, for the first time, we were going to count LGBTQ individuals in this country. And unfortunately, that administration at that time decided to remove the questions from the census. But it was the first time that census was going to actually collect information in this country. Well, I'm sorry, that was 2020. 2010, and then it wasn't added in 2020. And we're hoping that it will be added in 2030 so that we can get a really good idea of the representation of LGBTQ individuals living in this country. According to a report by the Williams Institute, and the Williams Institute is a wonderful place to go if you're looking for any statistical information related to the LGBT community, published in 2019 that it was estimated that around 4.5% of adults in the US, or approximately 11 million people, identify as lesbian, gay, bisexual, or transgender. We also know that LGBTQ older adults live in most communities throughout the US, throughout this country. Every state has identified LGBTQ citizens ranging from 1.7% of the population of North Dakota all the way to 10% of the population in the District of Columbia. So this is a map that shows the percentages of individuals who identify as LGBTQ in the different states. As you can see here on the top, in Washington State, it is about 4% of the Washington State population identifies as LGBTQ. And this, again, was also provided by the Williams Institute. So back a few years ago, the Seattle Times actually had published this slide about the cities with the highest percentages of gay, lesbian, and bisexual. And you can see that we rank number 2 after San Francisco. If you look at current data, we either are remaining in second place or third place. We're often in competition between San Francisco, Seattle, and Atlanta. But We are, again, there is a larger percentage of individuals, disproportionate number of individuals that live in Washington state that identify as LGBTQ as you look at other urban areas around the country. They did do a study and they on same-sex households by county, and they did find information again of if you look here in the coastal cities and states, you'll see a lot of stars here. Each star represents 250 same-sex households. And this was a study, again, that was done. So as you can see, there are many same-sex households throughout the United States. And this is from the New England Journal of Medicine. So LGBTQ adults are ethnically and economically diverse. They are also often isolated, invisible, or marginalized, even within their own communities. But it's important for us to make sure that we enhance our awareness and empathy. Many aging service providers see no need to discuss LGBTQ aging issues because, one, they believe that what someone does in the bedroom is none of their business. Number two, they don't want to discriminate, so they avoid addressing LGBTQ issues, or they don't want to make people feel uncomfortable, or they don't want to offend. So those are the three reasons that we often hear from organizations whenever we offer to provide training, or we offer to come in and train their staff on LGBTQ cultural sensitivity. Often we're told when we're working with housing providers that the training is not needed because they don't have people who live in their communities that identify as LGBTQ. They don't feel the need to provide this training. And so it's really interesting, some of the attitudes that are out there. And again, while this is well intended, it leaves many LGBTQ older adults feeling like they must hide who they are in order to take advantage of help, housing, and social services programs. So hands raised here. Again, I'm going to ask you in the chat box. Do you currently work with a colleague who identifies as LGBTQ? If you would raise your hand, and you actually use the reaction, you can use the reaction panel here if you like. So if you want to use the raised hand, that would be easier. So thank you for that. So far I have 12, 13. There's 28 of us in the room. And so far 15, 16 have raised their hands that they currently work with a colleague who identifies as LGBTQ. The next question is, do you have a friend who identifies as LGBTQ? The next question is, do you have a family member who identifies as LGBTQ? And lastly, are you currently working with LGBTQ older adults in your communities? So I remember when I started with the Housing Authority back in 2005 as a service coordinator, I remember every time I've put my office together, I always have some kind of symbol to let individuals know that I would be a safe person for them to share or talk to if they identified as LGBTQ, whether that was a rainbow sticker or rainbow flag or a pink triangle. I always try to have something in my office so that anyone who came to my office knew that I could be an ally or that I can be of support to them. And I never forget back then in 2005, I had an 80-year-old man resident who came to my office. And he said it was the first time he had ever come down to the service coordinator office. And he heard from another resident that I had a rainbow sticker in my office. So he came because he was interested. He wanted to know about me and whether or not I identify as LGBTQ. And again, this was an 80-year-old man, and it was the first time he lived in that community for 15 years. It was the first time that he felt validated, that he felt like someone could now help and provide him services, and that he would feel comfortable talking or speaking about his history and sharing information about his life. And that light bulb went off in my head that if this one person came to my office and felt this way, that there were probably other residents that lived in that community that probably were isolating just like he was. So I wanted to make sure moving forward from that moment that every job I ever had, I would always have something. You could probably see this. I have a badge here on my ID that says proud ally, and it has the rainbow flag. And I also have a rainbow heart on my name tag. So I always want folks to know that if they identify as LGBTQ, that they can come and speak to me, and that I will support them and provide them the information and referrals and resources that they need. Thank you all for sharing in the hands raised exercise. I really appreciate that. And on behalf of the LGBTQ individuals that you work with and support and are an ally for, I want to thank you on their behalf for everything you do. So let me ask you this question, and again, you can type the answer in the chat box. Why would it be important for affordable senior housing service providers to be aware of the unique aging needs of LGBTQ older adults living in your community? Why is this important? Why would it be important for you to be aware and participate in training and education to enhance your skills so that you can serve this community? And I'm going to go in the chat box and see some of your responses here. Thank you for the well wishes on my anniversary. I really appreciate that. So any takers on why they think it would be important? Good, here we go. When everyone understands more about how to be respectful, more people feel welcome to be themselves. Kelly, right on. Yes, to fully support a community, you need to be able to see the whole person, which includes everything from race and sexual orientation. Thank you, Jessica. Yes, very, very important. Thank you for that information and feedback. I think we can definitely learn from those comments. I think for those in aging populations, it's extremely important to feel seen and accepted. We only get more vulnerable as we age. Feeling supported is even more critical. Daniel, thank you for sharing that, because, you know, I'm going to be turning 60 this year in July. And I have to tell you that with the way the world is today, I feel more vulnerable and honestly very anxious and nervous about the future and what that's going to look like moving forward as I continue to age, in terms of my safety and security, which is something that I never thought I had to worry about in the past. But as I'm getting older and becoming more vulnerable, I'm becoming a little bit more feeling unsafe and unsure about my safety in the future. So thank you for sharing that. Thank you, everyone, for sharing. Appreciate your feedback. So there's some common assumptions that affordable housing providers have, or even any service providers when they're providing services. And a key issue affecting organizations that work with older adults is not that they don't want to work with LGBTQ older adults, but they often don't think they have any consumers, clients, or residents who identify as LGBTQ. So let's explore this a little bit further. So thinking that you have no LGBTQ consumers, residents, clients is an assumption, right? We know that pride comes in all colors, all ages. If you believe that you're not currently working with any LGBTQ older adults, you may be working with LGBTQ older adults who are not comfortable sharing that aspect of their identity, especially if you're still working with the older adult generation born prior to 1946. They were known as the silent generation. And those are the folks that today are currently 80, 90, and even centenarians, 100. So that they were known as the silent generation because they went with the status quo. They didn't question authority. They followed the rules, right? And then, of course, after that generation, we have the baby boomers, which were born between 1946 and 1964. And some of the early baby boomers also did not feel comfortable sharing. And a lot of this had to do because in the 60s and 70s, a lot of them, unfortunately, if they were outed or found to be LGBTQ, many of them lost their jobs, especially if they were teachers, if they worked in the military. a lot of individuals worked in government and were also lost their jobs back in that time era. So there's a lot of mistrust of government. You'll see there's a lot of mistrust of healthcare, and I'm going to get into more details on this in our community because of the experiences that we have suffered and some atrocious things that were done to us back then. So
Ruben?
service, yes.
Hey, you have a question in the chat
Okay.
from Chanel. I'm not sure if I'm pronouncing your name right. Do you have any recommendations on how to professionally shut down homophobic, bigoted comments with clients or residents?
Yes, I think the important thing is one, to have a policy and procedure in place that you can then enforce. So making sure that you use language. For instance, we have house rules, and which are expectations of how we expect residents to get along and how they should engage and communicate with each other. So that if you have something in writing, non-discriminatory and anti-harassment policies and procedures, then you can enforce those, right? We also have language in our lease, which also talks about the importance of being respectful and that harassment, discrimination will not be tolerated. And I also just frankly just go out. Again, if I hear something, I just say, hey, did I hear you correctly? I just heard this comment. I want to check in. I want to make sure that you understand the negative connotations of using this offensive language. And even if that person, if there's no one involved that's offended by this, you're still sharing this information in an open space in a common area where anyone can unfortunately hear or say what you just said. I often tell residents, you do have a right to freedom of speech, and you do have a right to even hate speech, but you don't have a right to share that in a common open space where other people are present. So I said, you're more than welcome to share that in your own private spaces, in your apartment. But when you're in a common area in our community and other residents are around, you do not have a right to sharing that information that can be offensive to other people. So I stop it. I say nick it in the butt as soon as you hear it. Make sure that you're addressing it. You can take the person aside, say you want to meet with them and talk with them privately. Sometimes you have to do it in a public setting. Because again, if I was a resident and I'm in the lobby and I hear people making anti-gay remarks, and especially because they know that I'm gay or they're assuming that I'm gay, and they're offensive and hurtful to me, I would want a staff member to step in and say, this is not okay. And if a staff member observed that and witnessed that and didn't intercede or say something, then I'm not going to trust that staff member. I'm not going to speak to that staff member and bring my business to them. I'll deal with them professionally, but I won't feel comfortable coming to them because I feel like they didn't protect me. They're not protecting me. And they didn't say anything about this offensive comment and they let it go on. So I have to assume that they're complicit or believe the same thing. So therefore, I'm not going to trust them. So it's very important for us. And that it's not only about LGBTQ. If they were making jokes about African-American individuals, about Latino people, about immigrants who don't speak English, I would come out and do the same thing. So we just need to make sure that we're addressing all offenses, not just those specifically to LGBTQ. I hope that was helpful, Chanel. And of course, we can talk offline at any time. If you wanted to consult with me, I'll be happy to do that with you and provide you with some additional strategies. You'll have some additional strategies as we move through the presentation today.
Ruben, I just want to add too, and I appreciate the example you gave. So I think it's always helpful for people to hear how they can interrupt, right? That's something that comes up quite a bit when you're talking about racism or anything else. Is the opportunity to educate as well.
Yes.
So thank you.
The other thing
I hope that was helpful.
The other thing I often hear, and again, I developed a curriculum for the University of Washington that they're currently using to train long-term care professionals and assisted living programs and nursing homes. And it's interesting, when we did outreach to offer this free training, a lot of the times what we heard from the providers was, we don't need that training here for the staff because we don't have people like that who live here. So service providers assume also that they can identify LGBTQ older adults who are accessing their services. They think that there's a gaydar, right, that goes off and says, oh, this person's gay, this person's not. I have to tell you, as a gay man, I have made assumptions where I've also been incorrect, where I either assumed someone was straight or heterosexual, or assumed someone was LGBTQ and they weren't. So even us, there's no such thing as a gaydar. There's no way to know unless the person shares that information with you. Um, we can't just make assumptions about people based on body language or their mannerisms or their dialect or the way they dress, right? We can't make those assumptions. If I often say my life is an open book, if you ever have a question, just ask me. I'll be happy to respond to any question you have. So not everyone's that way, but I am. I don't have a problem if someone wants to ask me a question related to my sexual orientation or my experiences as a almost 60-year-old gay man. I'll be 60 in July.
Ruben, I have another question in the chat, and it might be a question you'd want to take later, because I imagine there are other people on the call that could speak to this as well. But the question is from Daniel: as someone that has worked in affordable housing for years, are there aspects of the built environment you feel make a space feel safer or encourage positive community interaction, particularly regarding aspects of inclusion and awareness? What have you seen work well or work poorly?
Thank you for that question, Daniel. And yes, I will be addressing that and giving you some strategies toward the end of the presentation that I think you will be able to implement or consider implementing. So yes, I will be responding to that, Daniel. So thank you so much for bringing that up. Very, very important. And hopefully the strategies that I share with you on how to create those welcoming environments will help you in thinking about your community. So I put this slide here, right? You're resident, right? And then you're a lesbian resident. And it's the same person, right? Because again, it could be the same person, and unless the person tells us otherwise, right? So again, I just do this again to reinforce the notion that we can't make assumptions, and that most likely we are working with older adults in our communities who identify as LGBTQ, who may not be out to us for a variety of reasons. So it's important to use inclusive language and to welcome all folks in our communities, regardless of their sexual orientation or their gender identity, their race, right, their immigration status, any of those things. So please don't assume that all older adults are heterosexual, because they're not. Especially baby boomers. Baby boomers born between 1946 and 1964, as I mentioned, they were the largest generation, but now they've been surpassed. We've been surpassed. I'm a baby boomer myself. I was born in 64 at the end of the baby boomer generation. But now our population numbers have been surpassed by the millennials. But we were the largest population for a while. And there is a larger number of people within the baby boomer generation that identify and are open, proud, out as LGBTQ. So you're working with baby boomers. Those are the folks that are coming into housing today. Again, those are the folks that, like I said, I'll be turning 60. I'm at the end of the baby boom generation. But do you know that baby boomers started turning 65 in this country at a rate of 10,000 a day? And it started in 2011, and it will continue to 2023. So we still have, I'll be 65 in 5 years, right? We still have 5 more years of baby boomers turning 65 in this country at a rate of, again, 10,000 a day. And these are the folks that are now coming into our affordable housing communities. So if you're not currently working with LGBT, or you don't think you are, you probably will very soon. LGBTQ baby boomers will refuse to go back in the closet, right? I refuse to go back in the closet. And I will do whatever I can on my part to educate providers so that they can make it a safe environment for individuals. Because together we can prevent LGBTQ older adults from going back into the closet, right? Often individual staff members and organizations make additional assumptions in their practices and policies that unintentionally exclude or have negative impacts on LGBTQ older adults who are trying to access services. By not asking about sexual orientation or gender identity, we call it SOGI, So SOGI is sexual orientation or gender identity. Service providers believe they're ensuring that their organizations will not discriminate against LGBTQ people or risk offending them. I'm happy to say that many service providers, including housing providers, are now collecting SOGI information. It is part of their leasing application. It's part of their lease up where they ask questions on their housing application around sexual orientation and gender identity. And I think that is wonderful. Because our culture often desexualizes all older adults, service providers may think it does not matter if an older adult is LGBTQ. And we know that that's not true. Do you know that more than 60% of individuals who are 60 have sex at least once a month? And hopefully this is not your reaction when you hear that. So I want to share a little bit about sexuality among older adults because that's key and very important when we look at healthcare and addressing the healthcare disparities among LGBTQ. That's why it's important for us to know about their sexual orientation and gender identity because they are at risk for certain illnesses and again, health situations that we want to make sure that we're providing information and referrals and making those referrals to healthcare. So STD or STI, now sexually transmitted infections or sexually transmitted diseases, rates among 45 to 65-year-olds have nearly tripled over the past decade. A number of new HIV infections is growing faster in individuals over 50 than people 40 years and under. As of 2015, think about this, as of 2015, 50% of the men living with HIV in the US are 50 years of age or older. So half of the men living in this country that are 50 years or older are HIV positive. And it's not because they've become infected as they got older, but these are folks that have been living with HIV infection for 25, 30 years. Of course, there are always newly infected individuals. Actually, honestly, I had a resident recently in one of my communities who is 55, who came out to me and shared with me that he had recently been infected at age 55. So he was able to live, you know, and be safe and not worry about HIV. And unfortunately, at 55, he became infected. So older adults are getting infected. And just as another bit of information for you to have, do you know that older women, straight older women or cisgender older women are also at the highest risk of HIV infection because many of them are living in retirement communities in Florida, in Arizona, in Palm Springs, and many of them are dating again. And many of them may be dating younger men or even men their own age, but they never had to negotiate condom use or worry about HIV infection. And we're seeing HIV infection rates among older women also increasing in these retirement communities across the country. There's a video called Gay Seniors, No Kids, No Parents. It is available on YouTube. We don't have time to share that with you today, but I do recommend, I believe I made it as part, I included it in the handout. If you go to YouTube, here's the YouTube link, and I would encourage you to, I believe it's about 8 minutes long. It's not very long, but it kind of drives the point home that I'm making today in our presentation. And it was provided by Newsweek. They did a whole news documentary a few years ago, and this video was part of that. So what are some of the unique challenges to successful aging for LGBTQ older adults? The number one unique challenge is the effects of stigma, both stigma in the past and stigma that they're still dealing with today. Number two is the need to rely upon families of choice for care and support. And number three, continue to experience this discrimination and injustices, right? So we know these are some of the challenges. Many say that they feel invisible and overlooked. Do you know that LGBTQ older adults are among the most invisible of all Americans? Many grew up in the 1930s, 40s, and 50s and were forced to accommodate and stay in the closet. Again, I mentioned the silent generation. This was an article that was part of that series that Newsweek put out called Invisible and Overlooked, and you can find this article and read it. But it has, again, it drives home the points that I'm making today around the challenges that LGBTQ older adults face in this country. So what is the impact of LGBTQ history, right, on LGBTQ older adults? Again, many came of an age at a time when there was great prejudice and violence against LGBTQ individuals. Medical and religious labels of mental disorder or moral aberration validated their prejudice or this prejudice. LGBTQ people of color had to deal with both racism, prejudice about being LGBTQ. When you hear the term intersectionality, that's what we're talking about. As I mentioned earlier, I identify as a Nuyorican gay man of color, right? So I'm not only feeling vulnerable because I'm a gay man, but I'm also So Nuyorican is a Puerto Rican, a person who has Puerto Rican parents, but they were born in New York. So I'm a native New Yorker. I'm first generation. My parents were both from Puerto Rico, but they migrated to New York, and I was their first child. So those of us born in New York from Puerto Rican parents, we call ourselves Nuyoricans. So that's where the term Nuyorican comes from. And men of color, because I also have Taino, which is Native American blood from the Caribbean Indians. I also have African American roots. I actually did my ancestry and found out that I'm 11% Nigerian. So I also have African roots. So that's why I consider myself a gay man of color. Many individuals back then were also arrested in bar raids. They lost their jobs and were not able to find employment. There was high suicide rates back in those days when people were outed and they weren't able to successfully continue to find work so that they can take care of themselves. They were blacklisted. A lot of the times their information was published in the newspaper, and they were humiliated, and it was horrible. Again, and this was related to stigma, right? Many led secret lives or married and had children to fit in. So I share, my husband allows me to share. His name is Nick. So Nick is 6.5 years older than I. He was born in 1958. He was in the Coast Guard, and he married a woman, and they had a child together. And he had to do this because in 58, and I was born in 64, so I was just born 6 years later. There's such a big difference between folks that were born in the 50s and people who LGBTQ folks that were born in the 60s. And in his case, and I hear from a lot of folks that were born around that same time frame, they had to live a double life, right? Or what we call the down low. So even he knew he was gay, but he felt like he had no choice and he had to assimilate and he had to conform to what society wanted him to be. So he got married, he went to the Coast Guard, and he fathered a child. Today, our son, Alex, is 37 years old. Homosexuality was also considered a psychiatric disorder until 1973. Think about that. That was 51 years ago. So 51 years ago in this country, folks who were LGBTQ were considered to have a psychiatric mental disorder. And many folks were put in mental health institutions. And there was horrible things that were done in the name of studying, in the name of science. Lobotomies were done. Shock therapy was done. People were put in insane asylums with folks who did have severe mental health disorders, and they themselves developed mental health disorders because they were surrounded and impacted by the environment they were forced to live in. So sodomy laws, can you believe this? Sodomy laws were finally abolished in 2003, 21 years ago. So 21 years ago, I could have been arrested just for simply sleeping with another man. So, it hasn't been that long. So some of us are still remembering those days. Less
Ruben,
than uh
sorry, I thought I was trying to catch you in a pause. We've had a question in the chat about the cure for HIV/AIDS. Is this an okay time?
Sure.
Okay. So the question from Christian is just checking in about the cure for HIV/AIDS, that there are symptom management medications that make living with HIV possible and more normalized.
Christian,
That there isn't a cure.
Yes, thank you for that question. I really appreciate that, Christian. So technically, yes, there still isn't a cure, but we do now have a cocktail, medication cocktail, that helps individuals to be undetectable, which means that if you're undetectable, you also you can't transmit the virus. So for instance, I have friends that have been on HIV medication for many years, and they take the medications the way they, they adhere to, and they're in compliance. Because the thing with HIV medication is you got to make sure you take it the way it's prescribed, and you got to take it for the rest of your life. So now there's also PrEP for people who are HIV negative but at high risk of becoming infected. So they can go on what's called PrEP, which is the same medication that folks may take when they have when they're HIV positive, and that prevents the virus it protects them from being infected by the virus. But again, they also have to adhere to the strict compliance of that medication in order for it to work. So the great news now is that science has demonstrated that if you're undetectable, which means that if they take a blood test and there's less than 20 particles of HIV in your blood, that you're considered undetectable, which means that you can't transmit the virus. You don't have enough virus so that if you were to have unprotected sex or the condom broke or something like that, the likelihood of you infecting your partner are very, 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 very rare because you are undetectable. So the good news is that was not available even 15 years ago, and it is available today. So folks can either go on PrEP, and those folks that are HIV positive can go on medication that can also keep them from the virus from progressing. So it's not a death sentence anymore. It is more chronic manageable disease like diabetes. We say that if you follow your doctor's protocol and you take your medication religiously like you're supposed to, and many people are now living with HIV, and there are people that have been living with HIV now for over 30 years. So it is no longer a death sentence. But as far as a cure, there isn't a cure yet. There's been some stories about a couple individuals where they've been able to, and this was in Germany, you can look it up. There's some studies out there of two individuals that supposedly were cured from their HIV. And I think that's why there's a lot of misinformation on the web, or even conspiracy information around HIV. But technically, there is no official cure for HIV right now. But there is medications that can help people live longer. So folks don't have to die from HIV anymore if they comply, right? Most people that I know now that are HIV positive, and I have many friends that are HIV positive because unfortunately I grew up in the 80s. I did lose a lot of friends also, a lot of my social support network, unfortunately, during the 80s. I was in my 20s when, and I was living in New York, which was the epicenter of the HIV epidemic back in the early 80s. So many of my friends who are living with HIV now have been living again, who survived, are grateful for these medications and these treatments, and that they're still able to be active and be wonderful, contribute to society, and they have great lives, they have partners, and and they have work, and so it's no longer a death sentence. So if you have residents that are share with you their HIV status and they don't know what to do, the first thing we want to do is make sure that they get connected with a doctor who specializes in HIV, get a primary care physician that can help them and talk to them about their options, and they can work together with their doctor to make sure that they're getting the best healthcare that they can and the medications that they both agree they should be on. So thank you for that question. Also, when we look at LGBTQ older adults, they're twice as likely to live alone, to be single, and 3 to 4 times less likely to have children. And many are estranged from their biological families. They become isolated over time from their broader communities, including their places of worship, work settings, friends, and family. We often have smaller social support networks. Higher disability we also see, including mental health illness and poverty rates, and struggling with economic security, debilitating feelings of loneliness and depression as a result of a lifetime of discrimination. Many have experienced ageism, even within the LGBT community, believe it or not, which increases their risk for isolation. Our community, unfortunately, is so focused on physical beauty and youth that sometimes we also create issues for our older adults in our communities. Many who fought for the right to be openly gay in mainstream America now face a new challenge, remaining openly gay in old age. So again, together we can prevent LGBTQ older adults from going back into the closet. When we look at family dynamics, LGBTQ individuals have diverse family structures and relationships. Some have supportive families of origin, while others experience rejection or estrangement. LGBTQ people also form chosen families, networks of friends and community members who provide love, support, and acceptance. So we call this our family of choice or circle of trust. You'll hear those two words when we're talking about our family, people that we have chosen to be our family members that are not related to us biologically by blood. So you'll hear that term a lot. So again, just to share a little bit, to give you a perspective here, my father was a Pentecostal minister, and he had a real hard time when I came out in my 20s because of his religious beliefs. He really never accepted me as, accepted the fact that I was a gay man. We can talk about anything in my life, but I had to keep that part of my life a secret, and it was something he never wanted to hear about. So I can never bring home my partners or share any of my life as a gay man. I was not allowed to do that. So I will tell you that at one point my father did send me to go see a famous evangelist that tried to pray the gay out of me. So he tried to get me help. He thought in his mind he was helping me to change my ways by having me meet with this individual. But you guys have heard of camps where young people are taken to, ex-gay camps, pray away camps. There's some horrible things that have been done. Some youth and even young adults have been beaten or tortured in order to get them to change the way they feel around their sexual orientation. So my mother was very accepting. I was lucky on that part. I had a loving, nurturing, supportive mom, and she loved me regardless of my choice. At that time, they thought it was choice, right? She respected me as an individual. Yesterday was Mother's Day. I do not have my mom. I miss her every day. I lost her 12 years ago. But luckily, I had like I said, luckily, although my father had a hard time, my mom was really nurturing and loving. So many of us don't have the same support systems as our heterosexual counterparts. While many are close to their families of origin, some may have been rejected and have less support. So as you can see here, many rely primarily on partners and close friends for social support. And again, we call them family of choice, or family of origin, or circle of trust. So my husband and I have been together, and like I said, we celebrated 29 years this past Friday, and we are our major support system for each other. So the plan is for us to take care of each other if something was ever to happen to us. We do have a small social support network that can also help us if we both needed help or support because of some catastrophic illness or disability or financial, anything that we can't see coming. We feel comfortable that we have enough friends and some family support that can help us. So this article was also put out by SAGE, LGBTQ older adults and exclusion from aging program and services. So here are some of the barriers to access to service providers. Again, historically, service providers, including affordable housing providers, have been hostile to LGBTQ community, resulting in fear and avoidance. And that's due to lack of awareness, knowledge, and training, right? So we're going to talk about the importance of training. And thank you again, and kudos to you for attending today's training and enhancing your awareness around LGBTQ issues. Other barriers include the lack of or limited LGBTQ-friendly and affirming resources. Not here in Washington State, I would say, well, King County, I'm sorry. There's some areas in Washington State that have no services or they're limited resources for LGBTQ individuals in general. But if you're in King County in Seattle, we are social service rich in this part of the county, and there are many LGBTQ resources here in Seattle and King County. And there's a wonderful resource known as the Greater Seattle Business Association on GSBA, and they put out a directory of all the services that are LGBTQ friendly or run by LGBTQ individuals, and they come out with their directory every year during Pride. You can also find them online. I also believe I gave you the link at the end, their website, so that you can also go on their website. We also have a wonderful other resource here called Generations Aging with Pride, or we call it Gen Pride. And Gen Pride is the clearinghouse for LGBTQ information services and programs located here on Capitol Hill in our beautiful building called Pride Place, the first LGBTQ affirming safe place for LGBTQ older adults. So it's an affordable housing building that just opened up last summer, and it's right on Capitol Hill on Broadway, and it's called Pride Place. And it's for primarily focus and targets LGBTQ older adults, even though because of fair housing laws, we can't make it exclusive. So there are some folks that may live there that don't identify, but they are friendly, and they know when they move in that the majority of the folks that live in that community identify as LGBTQ, so that they need to be respectful of that. And it's called Pride Place, and it was built by Roots Housing with a grant from the Seattle Office of Housing. So we're really fortunate. It took a long time. Again, Seattle is always seen as either number 1 or 2 in this country as the largest population. And it took us all this time to finally open an affordable housing community for LGBTQ older adults. And I also put that information at the end for you to have that. Many individuals who work in the affordable housing or service providers often are unprepared to address acts of discrimination by staff or other older people. They may have lack of or inequitable policies and procedures. So let's talk a little bit about fears of harassment and discrimination, right? So LGBTQ older adults report they often face harassment or hostility when they're frequenting senior centers, volunteer centers, food banks, or places of worship. I can't tell you how many senior centers I have gone out to do trainings and to also do presentations with the members of the center because of the bullying that's happened and harassment and discrimination that some LGBTQ older adults have faced when they go to these senior centers or food banks. I've even done some training. I did some training with the Pike Street Market food bank there because they were having some issues there too with folks that were being offensive and disrespectful. So there's also lack of recognition and fear of discrimination by society, service providers, and families of origin. So that meaning that LGBTQ older adults also face discrimination and harassment from society, service providers, and even their families of origin. For many, home has always been the one place they really have to hide, right? Our homes are our sanctuaries. They're the places that we can go and be ourselves and feel safe, and we could dress however we want. We can, basically our homes are our sanctuaries. So we're very protective about who we allow into our homes. And a lot of that has to do with safety, right? So many LGBTQ baby boomers do not want to jeopardize their safety by being out to care providers or even housing providers who do not understand them. So they make the choice to go back in the closet as they get older. So again, we want to prevent this from happening. I mentioned briefly the distrust of healthcare. 56% of LGBTQ adults report experiencing some form of discrimination in a healthcare setting. 56%. LGBTQ older adults have been found to be 5 times less likely to seek health and social services than their heterosexual peers because of fear of harassment and discrimination. In a study by the American Association of Physicians for Human Rights, 67% of doctors and medical students reported that LGBTQ patients are denied care or receive substandard care. About 25% of transgender people report being denied equal health care or being refused treatment outright, with Latino transgender people reporting the highest rate of unequal treatment. This report is available to you. You can Google it. It's called Stories from the Field, and it's LGBTQ older adults who live in long-term care facilities. And this was a study report that was done a few years ago. And it documents all the horrific experiences that LGBTQ older adults have experienced in long-term care facilities across, I believe it was 16 states. But this report is available. I'll be honest, it is hard to read. It is hard to hear about some of these stories that are contained in this report, but this is the reality of what some older adults in our nation who live in our country have faced, and they have been brave and courageous to open up and talk about these stories. But when we look at harassment and discrimination, for many, doing without seems preferable to opening their homes to strangers who may not agree or understand their life. There's an increased risk of unaddressed healthcare needs, social isolation, depression, alcohol and substance abuse, issues of low self-esteem and self-worth, and even an increase for suicide. LGBTQ older adults who are still in the closet have a fear of people finding out. When they think of a nursing home, which will now be their home, it can be scary. Even people will see their personal things, their books, their photographs, their pictures that may represent them as gay. And they have a fear of this. I'll be honest with you, there were times when if I had a service provider if I own a home, I live in a home, and if I needed the plumber to come in, or I needed a cable company to come in, or I needed some service provider to come in, I would rearrange my apartment and even hide some of my gay stuff. So as to not make that person uncomfortable, or for them not to figure out I was gay, so that then they can, cause me any harm, right? Or let their friends know, hey, I was putting in cable at this gay man's house in Shoreline, and he has all this stuff, and, here's his address, So we always lived in fear that way, of thinking of whenever strangers came into our homes, what if they were homophobic? I'll be honest, there were times, and I know this for a fact, there were times when we did have a plumber come in and the job was not done correctly. And it was because that person wanted to work fast and get the hell out of my apartment or out of my unit because they didn't feel comfortable being in a gay home. And I learned quickly that I needed to make these changes so that things were done, repairs would be done correctly, and that I would be safe by just putting away some of my books, some of my artwork, hiding photographs of me and my husband and things like that. And again, we did that all to make that person feel more comfortable, and so they didn't discriminate against us, and they provided us with good customer service. And it's sad that we have to live that way and do those things. So some of the negative. Oh, go ahead, then.
Sorry, I never want to interrupt. But I've had a question hanging out there that feels appropriate given what you're talking about. This is from Cosima, and the question is: with queer community living spaces, how do you ensure residents are open-minded when you aren't able to discriminate and only accept queer residents?
And I'm going to get to that when I talk about creating, and we're getting there here in a few minutes, when we talk about creating those welcoming environments. A lot of it is education, right? A lot of it is educating our residents, providing symbols, gay, lesbian, LGBTQ symbols and posters and signage, and making sure that we have language again in our social media that says we welcome LGBTQ individuals in our housing programs, making sure that people understand about protected classes under fair housing and how violating those protected classes can get individuals in trouble. So we're going to get, I'll give you a little bit more information. We're going to get there soon, I promise. So LGBTQ older adults delay seeking necessary healthcare, which we know could put them at risk, right? So it's because they distrust the healthcare system, but that can be detrimental to their health. So we have to work with them and ensure them that it would be important for them to get the healthcare they need, because it can lead to premature institutionalization in nursing homes or in long-term care facilities, or can also lead to premature death, right? We know that there's some LGBTQ older adults that are dying unnecessarily just because of their fear of accessing services. So we have to also educate them that times are different, and that there are folks out there that we can help research and find doctors and providers that will treat them with respect and dignity, and who may also themselves identify as LGBTQ. I have a wonderful doctor. He actually is not a gay man, but he is a wonderful doctor, and he's been in the field for a long time, and He has made it his career to learn about gay health, gay men health, and he's wonderful. And I've been with him for over 20 years, and he knows everything about my life, and he's been there for me many times. So I share that story with my residents that there's hope, and there are people out there, and doctors and providers that want to help us and are not going to hurt us. So here we go. Inclusive, equitable, diverse, accepting, welcoming, safe spaces for everyone, right? So how do you create a welcoming and inclusive environment? It starts with your office, with your front desk, right? So this was at the Housing Authority, King County Housing Authority. This was our lobby. As you know, the main, you may not know, but you'll know now, the main headquarters is located in Tukwila. And as I mentioned, I worked for them for 12 years. I love working for the Housing Authority. I thought we did a wonderful job there. And again, it starts with how the lobby area, right? If you look at the first photo here, there's a charter here on the lobby, which is a big not poster because it was professionally done so that it looks like a poster, but it had all our housing resident rights and responsibilities. And in that resident rights and responsibility, it had language around LGBTQ. So if you were in the lobby and you read our resident rights, you would know that we valued LGBTQ older adults and that we would protect them from discrimination and that they were welcome at the Housing Authority and they were welcome in our communities and our properties. Then the middle picture is the front desk person. The person at your front desk has so much power and is probably one of the most important individuals in your company because they are welcoming people who are coming in for the first time, right? So a smile goes a long way. Using inclusive language goes a long way. So again, the front desk person, your receptionist, is key. This was my office, the third picture, and I'm putting an arrow because that's where I had my symbol of the pink triangle to let people know that I was an ally and that they were safe, and it was right on my front door. I also had a poster inside my office which said diversity is welcome here. So, simple things like that. Housing providers have a responsibility to create inclusive environments where all individuals feel welcome and respected. This includes taking proactive steps to prevent discrimination, harassment, or intimidation based on any protected characteristics. You can promote inclusivity by adopting non-discriminatory policies and practices, providing training to the staff on fair housing laws and diversity awareness, and fostering a culture of acceptance and respect within your properties. So developing LGBT-friendly communities. Here's some strategies. Ensure your organization's standards of care are inclusive of LGBTQ residents or consumers. Provide all your residents or consumers with respectful, culturally sensitive, and culturally competent care. Inform yourself about LGBTQ health and social issues and concerns. Be an advocate, support LGBTQ rights. Engage in open dialogue with all your residents. Ask about their life circumstances. Use open-ended questions. These are questions that can be answered with a simple yes or no. Share some personal history about yourself before inquiring into the biopsychosocial histories of your residents or consumers. Be open, ask questions, engage in appropriate self-disclosure. Listen to all your residents or consumers. Practice non-judgmental and empathetic listening. Ask your consumers to specify their own gender and define any terms or behaviors you're unfamiliar with. If you're not sure, simply ask them. Refer to your resident by the name they request, even if that's not the name in the application or paperwork that they completed when they came into your housing program. Utilize inclusive and affirming terminology, and that's why I spoke a lot about terminology earlier on, right? So now you're familiar with the term sexual orientation, gender identity. You might have seen MTF and FTM, right? So male to female and female to male that is associated with individuals who are transgender. Make sure you have this language in your agency forms and marketing materials, in your social media. Inform all residents about your agency's non-discriminatory policies, your consumer bill of rights, and anti-bullying. Use inclusive terminology like domestic or life partner or significant other rather than husband, wife, or spouse. You want to kind of avoid the terms Mr., Ms., Mrs., Sir, Ma'am, etc., unless the person says they want to be referred by those. Identify and designate staff or staff members that can serve as a consultant regarding LGBTQ issues or concerns, right? Kind of like an ambassador, an ombudsman. You also want to avoid tokenism, right? You don't want to just use the person because they are the only person in your agency who identifies as LGBTQ. You don't have to be LGBTQ to be an ambassador or to be an ombudsman. Make yourself aware of LGBTQ community resources or join an LGBTQ referral program. I mentioned the GSBA and Gen Pride. Those are your two real good resources right there. And always remember, first, do no harm. Post welcoming and LGBTQ affirming posters, stickers, or signs in a visible location. So here's some examples. So this is the poster I had in my office. This is a safe zone, all are welcome here. The one, the third poster here with the pink triangle. But there's many things that you can download now, and you can laminate and print out and frame and make look pretty. Place these in the community spaces, shared spaces in your housing community. Make sure that you're using language in your lease, in your house rules, right? I was going to ask you, how many of you know the history of the pink triangle? I wanted to share that because I often find that a lot of people are not aware of the history of the pink triangle. So the history, unfortunately, of the pink triangle goes back to the Holocaust. And the pink triangle was used to denote or to point out individuals who were considered to be lesbian, gay, bisexual, or transgender. These markings, these triangles were placed on the sleeves and on the shirts of the individuals who were living in the concentration camps. So as you can see, they had a color for all the different groups that were in the concentration camps. It wasn't just the Jewish individuals that were part of the Holocaust, but there are many other subgroups of individuals that were also killed during the Holocaust. And again, the pink triangle was to denote gay individuals. And you see from these photos, this is a group of gay men with the pink triangles. Here's some of the clothing that had the pink triangle. And again, this was a way for everyone to know this was a gay individual, or that and some assumptions were made. I understand there were folks that were not LGBTQ, but they were presumed to be, and they were forced to wear the pink triangle, even if they didn't identify that way. So let's talk about discrimination in housing. Do you know that only 19 states, including the District of Columbia, explicitly prohibited discrimination in housing? I'm happy to say Washington is one of those states. 73% of LGBT people are worried about housing discrimination, 73%. And up to 40% of homeless youth identify as LGBTQ. So when we look at LGBTQ, we know that many face anti-gay discrimination in housing, public accommodations, and medical treatment. Discrimination is often based on ageism, transphobia, and homophobia. LGBTQ individuals face discrimination when seeking housing, including rental or home ownership opportunities. Landlords or property owners may refuse to rent or sell to LGBTQ individuals based on their sexual orientation or gender identity. We know this still happens today. Even though there are fair housing laws, and even though LGBTQ individuals are considered a protected class, we're still discriminated against, which can result in housing instability, homelessness, and financial strain. So let's look at fair housing. Here's another wonderful thing you can download and print and laminate and frame. Everyone is welcome here. Housing providers must adhere to fair housing laws at the federal, state, and local levels. These laws prohibit discrimination based on protected characteristics such as race, color, national origin, religion, sex, familial status, disability, sexual orientation, and gender identity. Housing providers have a responsibility to ensure that their rental or sale practices do not discriminate against individuals based on any of these protected characteristics. So here's some discriminatory practices. 1, refusal of housing. 2, unequal treatment. 3, harassment or intimidation. 4, denial of services. And 5, eviction or retaliation. Here's in Washington State, this is our fair housing poster that we have in our communities, in our buildings. And you can post this up in the common spaces so that residents see this and know that we are adhering to fair housing laws. And you'll see that in the poster itself, it does say sexual orientation or gender identity. So this is an easy way to put, and you can print this out from the HUD website, or you can just Google it and you will find the fair housing poster.
Ruben,
Yes.
I'm going to interrupt for a sec. I'm sorry. There are only 3 minutes left.
Yeah.
And so I'm wondering if this might be a good time to pause in case there are additional questions or needs, and just verifying that the slides, I can send the slides out to folks.
Yeah.
Is this an okay time, or was there anything in particular you want to make sure you say before we close?
Yeah, there's a couple strategies I want to go through.
Okay.
Some of the questions, so I'll go through those. But here I just wanted to show that we have specific protected classes in King County, Seattle, and Tacoma. So you just want to be mindful of what the additional protected classes are. So I wanted folks to also be aware of the Washington law against discrimination, which protects LGBTQ individuals from discrimination in housing. It also prohibits discrimination based on sexual orientation and gender identity in housing, employment, public accommodations, credit, and insurance. It is illegal for landlords, property managers to refuse to rent, sell, negotiate housing based on a person's sexual orientation or gender identity. So I mentioned financial barriers, right? So LGBTQ individuals who may face financial barriers which prevents them from accessing safe and affordable housing. And this may be due to loss of job, due to job discrimination, wage disparities, lack of family support, higher rates of poverty. So just keep this in mind. We went into details on health disparities, so I'm going to skip that. But just know that the U.S. Department of Housing and Urban Development, HUD, enforces regulations that ensures that programs are open to all eligible individuals, regardless of actual perceived sexual orientation or gender identity. So best practices is to provide cultural competency and sensitivity training for all employees who work at the organization. It's important for us to work with affordable senior housing providers to educate them. And again, kudos to you for attending today. Thank you for attending this session. So here we are. So here are some of the resources. SAGE, which again is where the National Center on LGBT Aging is located. They have a whole section on education, and they do webinars and trainings. Gen Pride, which is our Pride here, our local resource for LGBTQ aging here in the whole Puget Sound area. So you can go to genprideseattle.org and get more information. Here's Pride Place. I mentioned the affordable housing community that was built on Capitol Hill down on Broadway between Pine and Pike. And again, even though we can't exclusively make it LGBTQ housing environment, the majority of the folks that live there are that we targeted and did outreach for were or gave preference to were LGBTQ older adults. Ingersoll Gender Center, great resource for individuals who identify as transgender. Wanted to make sure you had that information. Here's the LGBTQ suicide prevention resources. There's a trans lifeline. There's an elder hotline that folks can call. Here's the Gender Justice League, another really wonderful resource across Washington State and beyond. Here's GSBA, which I mentioned, the Greater Seattle Business Association, which has a directory, and you can go right on the website here and click on the directory and put in what resource you're looking for, and it will let you know if there is one. There's also the Northwest LGBT Senior Care Providers Network, and they meet monthly in different assisted living and long-term care facilities and provide training and networking for individuals who work in that field. There's the Seattle LGBTQ Center, formerly known as Gay City. PFLAG Seattle, Pride Foundation, which provides funding opportunities and scholarships for LGBTQ older adults and LGBTQ youth and younger adults. Sound Generations, of course, our AAA. We do work with Sound Generations often. The Rainbow Center in Tacoma. Did you know there was a Rainbow Center in Tacoma, which is the only LGBTQ community center specifically for here in the state of Washington in Tacoma. The SAGE Olympia, I mentioned there was a chapter of SAGE in Olympia. It is now called Sound Alliance of Older LGBTQ, and you'll see their website here. So they're still available in Olympia. Quail Park, I always like to mention Quail Park of Linwood because I trained the whole staff there several times over the last few years, and they have wonderful best practices and examples of what it is to run an assisted living facility that's open to all, respectful, and provides dignity and respect for LGBTQ. They have a rainbow flag when you come into their lobby. They have their resident rights and responsibilities with LGBTQ language. They have anti-discrimination, anti-harassment policies. They are a great example of what all assisted living facilities should put in place. AARP, of course, is another resource, and they also have a lot of information on LGBTQ. You can learn more by contacting me. You have my email, you have my phone number. Thank you again for being advocates for older adults in the housing field. And yes, I think we went over by 1 minute, Danny. But yeah, if there are any other additional questions, I'm happy to respond to those. Thank you again for taking time out of your chaotic and busy schedules and joining us for this Affordable Housing Week and this first session. I really appreciate you all.
Ruben, we appreciate you, and I just want to acknowledge you for all of the personal sharing that you offered us. It is very meaningful. You share so much of yourself, and I'm really grateful and honored to be your colleague and to work with you and to feature you as our first official session of Affordable Housing Week with such a potent presentation.
Thank you, Danny. I think it's important. I think people always remember stories and they remember facts or numbers or figures. So that's why I like to incorporate my personal stories, because I think those really have more meaning, lasting meaning. And people can always remember, oh, I remember this training and this person said this was their experience. So my life is an open book. Like I said, I love sharing. I've had difficult times, but I've also had some wonderful years. And I'm lucky, to have a partner and husband. We got married in 2015, but, prior to that, thanks to the voters here in Washington, they gave us the right to get married in 2015. And we were actually one of the first 20 couples to get married as soon as we were able to. But we've been together since 1995. So, yes. And I feel fortunate because I have friends that are either single or decide not to be partnered or have been partnered and are now widowed or divorced. And so, yeah, I feel blessed and lucky. So,
thank you. For anyone who's still on and has a question for Ruben, feel free to ask, but I just want to thank you all again. Thank our sponsors. I put the link in the chat for other Affordable Housing Week sessions, but really, truly grateful. Thank you so much, Ruben, and thank you all for being here today and kicking us off.
Thank you, guys. You take care, and thank you again for attending our session. Really appreciate it.
Thank you.
Thank you. Have a good one.